The Ghana Health Service has revealed that persons who have been vaccinated against the virus stand a higher chance of not being hospitalized. In an interview with Joy Business's George Riafe, Director General of the Ghana Health Service, Dr. Patrick Kuma-Aboagye, explained current data from the GHS shows that none of the persons who received the AstraZeneca COVID vaccine have been hospitalized since the recent surge in Ghana.
Our own production. And so that's ongoing, and so I'm sure with the process that take place, should include support to ensure that there's local capacity to be able to.
Any timeline for that, maybe by the end of the year?
I'm not part of that committee, but I'm sure they are working and they will share whatever plans they have with the people.
With respect to this cold chain facility, how soon will they be deployed? So because there's always been a problem about how we can take the Pfizer and the other vaccines.
We already have, through Zipline, we have more than 1.7 million capacity to store 1.7 million doses. We have additional, what has just arrived, we'll be picking them up today. And that should also expand it to about 1 million plus vaccines. But once we bring it all, we should be able to get enough vaccine, not just at the regional stores, about cold chain facility at the regional store, but also in the regions, at the districts, and in some big facilities so that they can store the vaccine and vaccinate people.
Let's now cross over to the Ministry of Information, where GHS Director General Patrick Kuma-Aboagye is addressing the media on the country's COVID situation.
We've not had vaccination, and that's one situation. And as we are all aware, adherence to protocol is generally low. And this is a call that we need to be able to take that seriously, especially in the wake of the current changes. So in summary, as at the 11th of July, we've had about 98,114 cases with 94,700 plus recoveries. We've tested more than 1.3 million people. As we speak now on our dashboard, we have 2,512 active cases. And as we understand, that is the number of people who are currently carrying the virus, with overall positivity rate of 7.3%. We've had a death of about 806. The last time I was here, the death was about 799 thereabouts. So we've had about 6 more since the last time we updated the data. Just a summary to just show you that we still, it's a Greater Accra and Ashanti region is where we have most of the cases. The next EpiCap, which I'm sure we are now, our journalists are all getting used to understand. You can see that in the last few days, there's a slight increase in the number of cases. We are hoping that this, we are able to control this by adhering to the protocols and bring it down. At the same time, you can see the number of active cases going up. We peaked about 8,000 somewhere in February, March this year, but we are also starting a rise to about 2,500, as I mentioned. Because the numbers are, the tests are usually batched, the number of the reporting may not be exact day, but if you have a 7-day moving average, you can see that even that also shows that our numbers are increasing. So that's it for the general population. But when it comes to the arrivals, we also started seeing a slight increase, which I'll show you later. We've so far had about 1,997 people testing positive on arrival. We've tested more than 366,000 people. Positivity rate is lower than the general community population, which is about 0.55, and the males account for the larger proportion of the cases. If you go to the next slide, you can see that I'm sure you saw when we had the spike, the India, Dubai spike, you saw the increases of the was picked up. You can see that we have also been seeing some slight increase in the report at the airport. The last time we were here, we explained to you that We have an outbreak in the sub-region, in other countries, and most of Africa. About 50% at the time of all the positive at the airport came from two countries, Sierra Leone and Liberia, and we mentioned them so that we are all cautious. So far in July, we have reported 100 cases compared to 144 in the whole of June. We are still not in the middle of July yet, so the projection is that they are likely to report more cases than we reported last month. But that also tells you that is sensitive to the changes around you. And so as they have spikes around you, you also see that more cases are picked at the airport. Okay, so in terms of the caseload, you can see that okay, let me use this one. Admissions in Greater Accra, you can see there's a slight increase as you go on. The critical cases are not significantly increasing, but it tells you that we are having some surge in the number of cases, which is, of course, represent a proportion of those who are positive. So what's happening also in our schools? A total of 363 schools have recorded cases. We have so far cumulatively recorded 2,323 cases in our schools since school reopened in January. 92.8% of them have recovered. There are about 166 active cases among students in 4 regions. That's Ahafo, Ashanti, Greater Accra, and Eastern Region, and 1 case in Oti. Overall, in the schools, Volta region has recorded the highest number of cases, accounting for about 512 cases across since school reopened, whilst Northeast has not recorded any case since school reopened in January. The next table just gives you the details of the number of cases per region. I think the last time we were here, we spent a lot of time on Achimota, so we just want to give you an update on where we are. In summary, a total of 1,173 students and staff have been sampled and tested in the school. The result available is 1,157, so that's nearly all. And we recorded 195 positives, and that's also part of the numbers that have caused our active cases to go up. 157 of them were boarders, 32 were day students, and 6 were staff. And 120 have recovered, and we have an active case of 75. Some of them are being isolated in school, very few are home, and then the rest are also at the National Isolation Center in Pantine. But that tells you that the appearance of protocol in a large cluster like where schools is extremely important, because one case can just spread very rapidly. And for a school that has day school, that will also be a possibility of spillover into the community. So we need to all be careful. So what have been the details of testing as of July in the school? So as we said, routine testing, we had done suspected cases, 539, and we have what we call strategic testing, because because the event of the Delta, we needed to ensure that we have a different strategy to quickly contain it. So we did what we call strategic testing, which is outside our clear policy. That's why we tested all day students and staff, just to make sure that we are able to contain the condition in the school. Out of the 634 strategy, we had 36 positives, and then 13 of them are still pending because we continue to take some samples still. So like I said, 14 of them are In at-home care, 145 of them have been isolated in schools. Some of them have been discharged anyway back to school. And that gives the total number 159. 107 has recovered. Those in isolation, those in the home care, 13 have recovered and come back to school. And then so we have a total active cases of 39 currently. So that's the one at home and then the 38 in school. I think we are all aware that we have, in the last 4 weeks, we have been experiencing an increase. And of course, with the fast-spreading Delta also becoming part of a lot has to be done. What we are doing is enhancing risk communication, and that's providing information about the areas of protocol, mask wearing, which is very, very low now. You go to town, I don't see anybody wearing a mask. The social distancing and avoiding the large crowds. This is something that we need to do, and this exercise is part of what we are trying to do, ensure that we as media men also remind people about the importance of protecting, because this disease, you need to have an individual responsibility and community responsibility beyond what the health sector will be doing in terms of providing you the public health measures that can use to apply to prevent spread. We are also identified COVID champions to really support adherence of the protocols. And so very soon we'll be seeing a few more people who will be part of the discussion to encourage more people to wear. For the schools, we are engaging stakeholders. We've engaged a few PTAs, religious bodies, organized groups, to ensure that we enhance the use of the protocols, especially in workplaces and in schools where we felt that some of them are relaxed. We want to enhance triaging in health facilities so that where people come with respiratory conditions, they are quickly isolated and tested or tried before they are added to the general population in the hospital. We never close down our holding centers. We are holding them at bay in case, but we are hoping that we don't get there. So that's why we are asking that everybody adapts to the protocols that we have experienced, that we have been sharing with you. As you can see, we are doing more testing because we have also enhanced our contact tracing rapidly to be able to contain and reduce the spread. Like I said, we are having more cluster spread now. But if we are not careful, we will move into generalized community spread. That's why we have a major spike. So let's try and contain where we have. Vaccination is an important aspect of the containment of this disease. And so far, we have vaccinated 1,271,393 people. The breakdown is that of this number, 865,000 plus have had one dose, and 405,000 plus have had their second dose, that they are fully vaccinated. What we are looking at is the difference of almost 400,000 more people who needs to be vaccinated, given their second dose. Okay. So I just move to the next slide of what is our preparation for further vaccines. Vaccines, we are expecting about 1.2 million Pfizer vaccines from COVAX through the US through the COVAX for us. And we are hoping that later by middle of August, it should be available for that. We also, as mentioned earlier, about 250,000 doses of AstraZeneca will be coming in for the second dose of those people. But obviously, we continue engaging other options to ensure that we have enough to cover all those who are waiting for their second dose. For Johnson & Johnson, we have an agreement with AU for about 17 million doses. We are expecting that by middle of August or end of July. Actually, they mentioned that maybe by end of July we may get some sample. But I think because of all this schedule and changes, we are just making it tentative. But if it happens, that's what we are all hoping for, so that we can start giving some Johnson & Johnson as part of the dose. But to prepare for more vaccines, we have had to upgrade our cold chain facility, especially the ultra-negative cold chain, which can store Pfizer, Moderna, and the other newer vaccines that we talked about. So far, with our collaboration with Zipline, we have the capacity to store about 1.7 million doses out there. Yesterday, we received 16 ultra-negative cold chain vaccines that will be distributed to all regions to ensure that we are able to vaccinate all people. And then we are expecting additional deliveries of delivery vans and fridges bought by the government to augment our capacity across the country. So, Honorable Deputy Minister, in summary, ladies and gentlemen, our outlook is that the active cases have seen an increase in the midst of peer adherence to the COVID safety protocols. The Delta variant presents a threat and is currently a threat, and that is probably leading to the wave that we are having. And so we do not need any additional protocols because we have Delta or anything. All we need to do is to continue with our wearing of our mask, ensuring that we're doing our social distancing, we are clean, washing our hands, or using sanitizing our hands, and avoiding crowds. And I think with that we can break the transmission in Ghana. Thank you very much.
And thank you for the wonderful work that you are doing for Mother.
And you have Dr. Kuma-Aboagye giving us an update of the country's COVID-19 situation. He's been talking about how the Delta variant is dominating new cases we're recording in the country, and the fact that if we're not careful, we will be overwhelmed. He's, however, explained that government is making all efforts to ensure that the rest of the population is vaccinated. And of course, he's also urging the public to take the COVID protocols seriously and observe them. And he's been also issuing a warning this afternoon that the COVID restrictions are still in place and people will be dealt with if they do not obey the rules. And that has been the briefing he's been giving to the media. We're still live on the pulse and we're still monitoring events in our various hospitals, and we'll be telling you more on what is happening. But the message is that the Delta variant, which he says is very dangerous and presents a danger to us, is what we're dealing with right now. And he says we must all be careful and stay safe out there. So please stay safe out there.